Ped Talks, connecting through community. Hello, today we have the pleasure of speaking with Dr. Chase Moon. He is an environmental pediatrician at Icahn School of Medicine at Mount Sinai. He is also the Environment and Public Policy Committee co-chair for the New York State American Academy of Pediatrics. Welcome, Chase, to the podcast. We are so grateful to have you here.
Yeah, thanks, Shannon. It's so great to be here with you this morning.
I've actually had people ask me, what is an environmental pediatrician? Can you sort of explain what your role is, both as a doctor and this specific specialty?
Yeah, that's a great question. So I kind of think of it from the environmental side and also the pediatric side. So starting with the environment, we take a very broad view of the environment. So it's things that you would traditionally think of like nature, the places that we live, where we work, but we also think about like the environment inside the home. We think about schools, we think about daycares, we think about pretty much every sort of environmental exposure that a child can experience and how that can impact their health. And then when we switch to the other side, to pediatrics or children, right, we also take a very broad view of children. So we think about exposures that happen to parents before a child's even conceived and how that can impact their life. We think about exposure during pregnancy, and then afterwards too, we think about it even going into adulthood, because there are exposures that can happen early in life that have impacts across the lifespan.
How do you go about your advocacy to try and educate the public and educate your patients on these chemicals and how they can cause these specific symptoms that are not usually visible to the eye?
So what makes it challenging in pediatric environmental health is that sometimes it's easy, right? Like sometimes the insult is so bad that the child or the infant can present and we know that it's directly caused by that, right? Where the real challenge comes in is that a lot of these toxins and pollutants have subacute or subclinical effects. You could be walking down the street and you could have a slightly lower IQ, you could have slightly more trouble, interacting with other people in school. And, no one could really know that unless you're thinking about it, right? Or you're thinking about some of these exposures that happened earlier in the lifespan. So sometimes it's subacute, and the length of time between the exposure and the insult, and then when things actually present, can make it super challenging to say like this is connected. So I'll start with educating patients and community members, right? And the way we try to do that is we just try to meet the patients or the families or communities where they are first, right? Like, what are your concerns? And then starting from there and saying, okay, is there a true exposure? We have to have a lot of conversations with families that say, we may not ever know what caused this, right? But we know it's here, and there's ways that we can treat it right now. And then there's also ways that you can reduce your risk in general, right? Going forward in the future. So yes, you were exposed to lead or you were exposed to PFAS in your home. We're going to get rid of it now. And these are ways to prevent further exposure going forward, so you can put your best foot forward.
How do patients come to you and your clinic? Like, are they referred, or are you a clinic and then sort of decipher from your exams that the child has been exposed? How does this happen?
We have, it's called a Pediatric Environmental Health Specialty Net. It's also abbreviated as PESU or PESU. That's actually a federal network that's funded by the EPA, as well as an agency called the ATSDR, or Agency for Toxic Substances and Disease Registry. So there's a federal network of these centers kind of at children's hospitals around the country. So we have a consult line where anyone can call in toll free, or we have an email. We take a lot of those phone calls, and we start with just a history taking, right? We start asking about, a lot of the questions are around people's homes, but also we start to get into some of those exposure profiles and to the real nitty gritty, right? So like if you're concerned, for example, for lead, right? Like, okay, have you had any lead testing done in your home? Like, where do you think the source is, right? Or are there water lines, that could be contaminated, that sort of thing. And we start going through the history that sort of way. And then we can start offering some sort of like recommendation and guidance, right? Sometimes you can't completely eliminate an entire exposure, right? Like we know lead is everywhere. So a lot of it is like a risk benefit situation, right? Like these are your options, and some of them cost a lot of money. Some of them are much easier, right? but you have to decide what level of risk you're willing to accept for this hazard, right?
Right.
It's really providing like a menu of different options of like, there's, ways that you can easily reduce your exposure that are cheaper, right? Like when we think about things like gas stoves and all the pollutants that come out of gas stoves, just like tailpipes, right? Like you could switch to an electric stove, that's a lot of money, right?
Yeah.
But if you have like if you have a vent above the stove that you don't turn on, or if you open your window, like that helps reduce exposure real time without having to spend all the money on something, right? It's just kind of like any other habit or health decision you want to make. Like you have to start small, take a small little step, and once that becomes a habit, you take the next one, right? And we can help you make that sort of decision there. And a lot of that can be accomplished outside of a clinical visit.
What are some of the biggest obstacles you see in your advocacy work to get the laws, the policies in place to stop the exposure of these toxic chemicals with children?
There's two big barriers. The first barrier I would say is just like a lack of public awareness around a lot of these issues, right? Not necessarily even a lack of education. I think you and I have seen when it comes to things like lead, people know lead is bad, right? And people know it's bad for children, they know it's bad for themselves. But they just don't know that it's still a problem, right? That's something that comes across all the time is I thought that was a thing back in the 70s or the 80s, right? Or even the
Right.
90s, but like, wasn't that all taken care of? The other second big barrier, I would say, to getting public policy enacted is we often have like industry and business interests on the other side, right? Lead was first reported as like lead poisoning event in a child in 1904 in Australia. And
Yeah.
within 4 years, one of that pediatrician's colleagues was saying, lead, this is preventable. And it may take, they were calling it in 1908 legislative interference, right? But they were calling for advocacy. Like, and Australia started banning lead paint. But unfortunately, there was a whole lead industry, right, going on that was able to convince a lot of countries to say, lead is good. And lots of countries took up lead paint. They took up lead pipes. They took up, put a lot of lead in everything. And here we are dealing with it decades and decades later, and all these hidden costs to both people and our infrastructure, our environments, right? And that's true today too, right? When it comes to things like PFAS or other toxic chemicals, there's always businesses on the other side that saying this is good for business right now. But it's also, the lead example is so poignant, right? Because like it's also a warning for all these other chemicals that like we have to ban them. And even if we ban them today, like it's still going to be decades of work to get them out of our bodies and our environment.
I think there is also just like cause fatigue. Like it seems like, especially right now, there's so much need in the world. Why should people focus on lead and toxic chemicals with children specifically?
I think it is such an important issue because it's really addressing a lot of root causes for a lot of illness in our society, right? So you get rid of these things, you're setting people up for a healthy foundation for the rest of their lives. It's also shown to be very cost effective to, put these sorts of public health interventions into effect. Addressing these things at the source like this for toxic chemicals and other sorts of pollutants, like it's good for people, it's good for our communities, it's good for our society. To me, like that's checking all the boxes, right?
The CDC has estimated that 500,000 children in this country are lead poisoned. And that was just posted this August. So it is so difficult to know as much as I know now, but it's also still infuses me with compassion because until my kid was diagnosed with lead poisoning, I didn't know it was a problem either. And I didn't know how awful the side effects can be.
Lead has a lot of toxic effects on childhood development and across really the human lifespan. And it starts from whenever the lead enters the body, whether that's the child or the mother before, pregnancy occurs. There is no safe level of lead in the body. We know that much, right? The higher your lead level is, the lower your IQ becomes over time, right? And IQ is not the best measure for many things, right? Like what does that really mean in practice? We know that it means that kids have a harder time reading in school, having a hard time concentrating in school. They're at higher risk for things like hyperactivity, disattention, ADHD, right? Any sort of behavioral issue. We know, especially when you get later in adolescence, right, the teenage years, that these things correlate with things like conduct disorder, being more involved with the police, which isn't good with society either. We also know, especially later in life too, that lead is filtered through the kidneys, right? So lead can cause kidney damage starting in childhood and adolescence, right? And that can cause worsening kidney issues in adulthood, kidney failure, right? It can lead to higher blood pressure in adults when you're having kidney issues. It also affects fertility, especially in males too. So it really does span the whole lifespan. Children are especially vulnerable to it when we're thinking about things like lead paint and lead pipes. Those are the kids that are crawling around on the ground, right? They're putting lots of things into their mouth, and often lead paint turns into lead dust, and you don't know what's in your dust, right?
I mean, it's a really harsh reality when your kid is lead poisoned, because there's sort of like almost a Lady Macbeth like sort of overtakes you, where you become obsessed with cleaning everything. You're monitoring everything that goes into their mouth. It's so easy to get overwhelmed and fearful for your kids these days, and it's really easy to shut down, and it's really easy to just want to like stick your head in a hole and be like, forget it, there's just no way I can even begin to deal with this. How do we sort of instill that hope that we see in Albany when we go there and we see all these people working towards change and working towards protecting kids? A child has plasticity of the brain. We can help kids once they're poisoned. Of course, we want to stop it before it happens, but I just kind of want to say to parents, like, we can do this.
Especially when you're starting to look into these issues, like it can be very overwhelming, and it feels like there's nothing safe in your home or in any environment, right, for you or your child. And that's where we often meet parents, right, is where they're really stressed. They want answers right away. Like, how can I protect my child? Oftentimes, right, there's like a little bit of guilt. Like, how did I not know about this beforehand? Like, right. But like, it's everywhere. Like no one is perfect, right? And that's what we're all here for, is to help support people through this.
I just remember being in Cooper's pediatrician's office half the time, like pretty much almost shaking with fear with everything that was happening to him. There are places to go. There are places and people who are leading the charge, who are there for you, who are trying to do their very best every single day to make sure that children are protected and their health is looked out for.
I would say in general, pediatricians are really great, but sometimes your regular pediatrician may have trouble answering some of these questions.
Right.
Because there's not a lot of education around these issues. And that's where we come in. We're trying to help educate other physicians so they're able to answer these questions. But that's why we also have so many people come to us, and they echo so many of the things that you've also said, Shannon. A lot of the calls that I get, one of the common themes is like just relief of having someone who can listen to them, and maybe they don't have like the perfect answer to their question, but they're able to answer some of their questions, right? That's a common thing that I hear, is just like, I'm so glad that someone finally is listening, right, and is able to give me at least a little bit of guidance, even if you can't answer everything. And that's what people are really looking for. So we're hoping to, over the next few decades, right, like where does medicine go as the future, right? Like putting the environment into health is definitely one of those places where we're working to build those connections and make people healthier.
Right. And we'll do it through hope, not fear.
Yes, that's the goal.
And I just want to say thank you so much again. And I look forward to next season.
Yes, me as well. Thank you so much, Shannon. It's been great being here with you this morning.